Many people actually should just get a face and neck lift because it's the same incision, gives you a much better result. There's confusion in plastic surgery, even among plastic surgeons in different plastic surgery practices and consequently patients about the terms facelift, neck lift. Part of the confusion is because we're all probably talking about different things. Some patients come in and say, I need a facelift, but they expect the upper part of the face to be dressed. And most practices, that's totally separate. When we speak of facelift at Wave Plastic Surgery, we're talking about basically this mid-face from the cheeks down to the jawline, where we make an incision, basically to 7 or backward 7, depending on which side of the face you're on. The incision comes down along the front border of the ear and stops just above the earlobe. And then we lift the mid-facial structures. That is known as a facelift, or some people call it a mini facelift. When we talk about neck lift, well, we're talking about from the jawline on down. A lot of times patients come in and say, I want this fixed. See what happens when I do this? Well, really what I'm doing is I'm pulling the skin in front of the ear. So really what I have to do in a neck lift procedure is I make the incision behind the ear, and to effectively lift it, I have to carry it in front of the ear. In many cases, it ends up looking like a facelift incision. Sometimes patients will ask, do I need a neck lift, or will the facelift be enough? Well, the facelift procedure, which has the limited incision, will affect the jawline quite a bit, the neck very little. Now, if you see a heavy jowl, or if you have any indication of neck laxity, then I would add the neck lift to a facelift. Many people actually should just get a face and neck lift because it's a similar incision. You might as well do both, and it gives you a much better result.